Hello and welcome to tonight's webinar from the Lymphedema Advocacy Group. Tonight we're going to be discussing the LTA draft rules, talking points, and guidance for submitting comments. Our agenda for tonight, we're going to quickly introduce ourselves. We're going to go over the draft of the proposed rule, topics for comments, general guidelines for submitting comments, the process and timeline for submitting comments. We're going to provide some additional resources, and then we'll take questions and answers and have our contact information available for everyone. So first, to do introductions, my name is Sarah Bramblett. I'm the board chair of the Lymphedema Advocacy Group. I'm also a patient with both lymphedema and lipedema, and I'm a Medicare beneficiary. So next, I'm going to have Francie introduce herself.
Hi, I'm Francie Schwab. I'm a Lymphedema Advocacy Group board member. I've had lymphedema secondary to breast cancer for about 15 years. And now I'm a Medicare patient, so I will be fortunate enough to be covered for the compression garments that are so critical to my everyday quality of life.
And Heather?
Hi, I'm Heather Ferguson. I'm the founder and executive director of the Lymphedema Advocacy Group. And I have a 16-year-old son who was born with lymphedema. And tonight I'll be presenting along with Sarah, as well as monitoring the Q&A for questions and helping to answer those questions. Some of them we will respond in writing, and others we will choose to answer live at the end of the presentation.
And we have another person on our team who's not on video, but Cindy, if you'd like to introduce yourself.
Hi, everyone. I'm Cindy Cronick, and I'm also a board member. I live in Wisconsin, and I have secondary lymphedema in my arm and hand post breast cancer treatment. So I'm happy to be part of the group tonight, and I'll be asking some questions in the Q&A section.
Thank you all. So yes, it's certainly a team effort, especially pulling off these webinars. And I know some other people have joined since we began. So I just want to remind everyone is in listen only mode. We're going to present the information, and then there will be opportunities for questions and answers. You can also post a question in the Q&A, depending on what type of system you have. Most of the time it's on the menu at the bottom. There's two little talking clouds and it says Q&A. And you can post your question there, and we will either answer it live or answer it just in that system. And once it is answered, everyone will be able to see the question and the answer. So again, I just want to highlight, as we mentioned, not just a group process between the members of our organization, Lymphedema Advocacy Group, but this has been a group process amongst several other organizations. And this is just many of the organizations that have held listening sessions with CMS, which is the Centers for Medicare and Medicaid Services, since January. As soon as the Lymphedema Treatment Act got passed in December, we took maybe a little bit of a breather for the holidays, and we got right to work on making sure the implementation was underway, because the coverage does take effect January 1st, and that was quite a tight turnaround for CMS to get the implementation details. But now we have them, and as the Lymphedema Treatment Act passed as part of a larger package in December, the Lymphedema Treatment Act details of coverage are part of a larger what they call it rule, and it's the home health proposed rule. And just want to remind everyone, the Lymphedema Treatment Act is specifically regarding creating a new benefit category for compression garments and supplies, because there was currently no benefit category under Medicare that covered compression garments, because of the definition of durable medical equipment was typically a product that lasts 2 or 3 years. And the longevity of compression garments and supplies does not meet that definition. So the coverage and the details information have nothing to do with pumps or surgery or manual lymphatic drainage. Those treatment items are already covered under a benefit category. They might not be covered well, but they are already covered under a benefit category. So to improve coverage for them didn't take an act of Congress. So again, this is the proposed rule. It's under the home health. We do have a link to the full draft rule. It is several hundred pages, so we pulled out just the section that discusses the Lymphedema Treatment Act implementation, and we have a link to that also. And these are some of the items that between Cindy and Francie and Heather, they will post those in the Q&A so you can find them. So last week we went over the details of the content and the details of the proposed rule. And so tonight, again, we're going to talk about the different topics that you can include in your public comment. So some of the things that we like, and we have gotten feedback that from positive response from everyone, is the proposed details cover a full spectrum of treatment items. It will include both standard and custom fit garments, and compression wraps with adjustable straps, and compression bandaging systems. Also, the quantity limits are based on sets and not numbers of pieces. It actually sets per affected body area. And so we wanted to make sure that was something very important when we had our listening sessions with CMS, because we know people with bilateral lymphedema, or some people have both lower and upper extremity lymphedema. We didn't want it to say just one garment or two garments. Specifically, we want to make sure that people who needed multiple garments because they have different areas affected by lymphedema would be covered. And that brings us to the third section is they recognize that lymphedema is in all areas of the body, not just limbs or extremities, but also the head, neck, torso, genitals, et cetera. And they will receive the same coverage for needing compression garments and items for those body parts. So some additional topics for comments. So currently, and again, I have it in the lower left or lower right corner, this is only a draft. This isn't the final rule. And the public comment period is our ability to comment on, what we like or what we'd like to see changed. So currently, the proposal is to cover 2 daytime garments every 6 months per affected body area. And for nighttime quantities, the rule proposes covering 1 nighttime garment every year per affected body part. So in the rule, CMS specifically has this ask that they are soliciting comments on whether 2 nighttime garments should be allowed, with both garments being replaced once every 2 years, to allow for more than 1 day for washing and drying of the garments. So if this is something that affects you and you have feedback on it, I know not every patient uses nighttime garments, but for those that do, this would be a specific area that you want to highlight your comment that CMS is soliciting feedback on. I just want to add, this is specifically something they're asking for, but of course you can comment on any part of the rule that you want to comment on. So the other coverage topic for comment is the exceptions for sooner replacement. So both day and nighttime garments can replace sooner if the item is lost, stolen, irreparably damaged, or if needed based on the change in the beneficiary's medical or physical condition. So this was also something that we were pleased to see included, because that was a concern we heard from patients, is if something happens or if they have a job or some activity that their garments get worn out sooner, or for example, if you have some type of flare up and your limb gets larger and you need another garment, or if you have something where perhaps you lose weight or something and the garment is too big in that time period. So this provides that exception for being able to replace sooner than what the 6 months or the 1 year, as mentioned in the previous slide. So coverage for accessories. Oh, sorry, let me go back. So additional covered items would include accessories on the garment, such as zippers, liners worn under the garments, or wraps with adjustable straps, and paddings or fillers that are necessary for the effective use of the gradient compression garments, or wrap with adjustable straps. And CMS specifically soliciting comments on the topic of coverage of accessories necessary for the effective use of gradient compression garments or wraps with adjustable straps, including the codes that should be established to describe these items, as well as comments on whether there are additional items other than the gradient compression garments, gradient compression wraps with adjustable straps, and compression bandaging supplies that could potentially fall under this new benefit category for lymphedema compression treatment items. So this was another positive add that we saw included. But again, we want to make sure that they do have a full understanding of what is needed. Some of the other items we didn't necessarily list, but some of the other accessory items that have been mentioned are like the non-slip padding on the bottom of some of maybe the nighttime garments, and some donning aids were actually also mentioned in the rule. So this is an area, so the coverage for layering garments. So this is something that's not mentioned in the rule, but it has been brought to our attention that some patients do need this due to the ability to don the garments or just for other medical reasons. So the draft rule does not mention how coverage would be handled when it is necessary to layer compression garments. For example, using 2 lower compression garments on the same body part to achieve the effort of a higher compression garment, and the patient is unable to don or doff. So specifically, if this is something that affects you or some of your patients, you want to mention that in your public comment. And I think we're going to inquire more. But since the current quantity states 2 garments per affected body part, if your body part, like your lower leg, you wear 2 lower compression at the same time, then you would need more than that, since you're wearing 2 on that body part at the same time. So this is an area the draft rule doesn't mention. So we want to, anyone that it can comment on that from personal experience and add that to their public comment. And then coverage for bandaging supplies during the maintenance phase. So compression bandaging systems will be covered without limitations during the intensive reduction phase of the treatment. However, the rule does not specify whether compression bandaging systems will be covered during the maintenance phase. And this is another area where we know there are patients who, after the reduction phase, they continue to wrap, especially at nighttime. Maybe they prefer to wrap at night or even during the day, or keep wrapping available in case they have cellulitis or a flare and they're able to wrap themselves to get that reduction. So we do have that. We want to provide feedback to CMS regarding the need and about coverage for the bandaging systems being covered during the maintenance phase of treatment, and not just for the reduction initial phase. So reimbursement codes for specific pieces. The draft rule contains a list of proposed new reimbursement codes. If you believe there's an item missing from that list, it should be noted in your comments. For example, toe caps, it has been mentioned to us. The list of those specific codes are part of the draft that we provided the link for, and we'll also make sure we provide that link in the question and answer area, and it has been provided throughout many of the newsletters that you have received in the past week. And the next item is the calculation of reimbursement rates. CMS proposes that 2024 reimbursement rates will be determined based on existing reimbursement amounts used by Medicaid and TRICARE, and when necessary, average online retail pricing. We certainly want reimbursement rates to be adequate so that vendors provide these supplies. Heather might agree with me, but the reimbursement codes and the reimbursement rates are kind of a bit outside of our organization's knowledge, or our specific knowledge. The US Compression Alliance will be hosting some informational sessions also. So if you're a vendor or a therapist or a professional who's treating patients who has more of an interest in the calculation of reimbursement rates and the codes being used, look for in your inbox. You might have received a invitation for those sessions. And if not, you can send us an email that'll be available at the end, and we'll get you connected with that information. Reimbursement codes for the application of compression bandaging. So we mentioned that compression bandages wouldn't have a limit, and the bandaging systems themselves will be reimbursed. But in the reduction phase, of course, your physical or occupational therapist apply those. So compression bandaging systems applied in a clinical setting as part of phase 1 decongestant therapy would be items covered under the new benefit category for lymphedema compression items. But CMS is specifically soliciting comments on the topic of coverage of compression bandaging items under the new benefit category, but lymphedema compression treatment items. We are also soliciting comments on whether the professional services of applying these bandages could be covered under another Medicare benefit category, such as outpatient physical therapy services under Section 1861P of the Act, or physician services under 1861S of the Act. And of course, they say outpatient physical therapy, and we know it could be occupational or physical therapy. And both those professional organizations that represent those therapists have participated in the process of implementation and will be communicating with their membership regarding this. But so again, if you are a therapist on the call and you have comments to submit in regards to this, you can include that information whenever you compose your public comment. And this is another topic for our therapist colleagues, the coverage rules and reimbursement for measuring of compression garments. Payment for measuring and fitting are typically included in the reimbursement rates when these services are provided by the vendor. The therapist were to provide the measuring and fitting services. The supplier would be responsible for paying the therapist for these services. An alternative option, which CMS is not proposing but is seeking comment on, would be to pay out separately for the fitting component furnished by the therapist and then back this payment out of the payment for the garment. So again, CMS has specifically asked for comments on the topic and comments on options to resolve the issue we outlined previously, which is the payment typically goes to the vendor because they provide the fitting. But in these situations, we know that often therapists are doing the fitting for patients, but that there are fitters who do fittings for patients. So they are soliciting comments on the topics and options to resolve the issues outlined. We're also welcome comments on whether any HCPCS level 1 codes may describe the services of the therapist in these scenarios. So I know myself as a patient, in regards to this question, I might just specify how I am more comfortable being measured by a physical therapist or occupational therapist because I'm a advanced stage. They're more familiar with my legs. It's more comfortable setting. But I do know also there are patients who, once you do the reduction phase, you only need measurements every 6 months. So we certainly see that there is a need to have patients have that choice of whether they get measured by a therapist or whether they get measured by a fitter. And again, we invite any vendors, any fitters, any physical occupational therapists who are currently, of course, treating patients to please provide feedback on this specific question that CMS has. Heather, do you want to go ahead and take over the general guidelines for submitting comments?
Sure. So first of all, I just want to remind you that it's important for everyone to submit comments. So we will be submitting comments as an organization, but your individual voices are very important as well. And this is your chance to provide feedback. The comments can be supportive or critical or some of each. So many of the things that we mentioned tonight are things that we're really pleased with in the rule, and we want to make sure that those things stay. So it's important to point out the things that you are supportive of and agree with, as well as anything that you think might need changing or clarification in this draft. And also do not feel obligated to comment on everything. So we tried to cover all of the possible topics tonight, but you should pick and choose just the things that you personally have expertise or personal experience with and just comment on those things. You can go ahead and go to the next slide, Sarah. Great. So know that all of your comments will be read by CMS and they are posted online for public view. So many of our advocates over the years have shared their lymphedema stories and often shared deeply personal information, and that was very powerful and very helpful in getting the bill passed. But just know that your comments will be posted online for anyone to read. So make sure and not share anything that you would not be comfortable having shared in that situation. And the quality of your comment is far more important than the quantity. So again, don't feel obligated that you need to comment on all parts of this. And likewise, it's more important that we get really high quality comments that are very personal and detailed than just a large volume of comments. So for those of you who worked with us over the years getting the bill passed, you know, there were times when we said, please ask everyone you know to send this pre-written message to their members of Congress. But that is why we will not be providing any sort of template communication in this case. And that's what the next bullet point addresses. You do not want to copy and paste any of our information or any information that you might receive from another source, because CMS will see that as a duplicate comment and it will be discarded. So it is important that your comments are unique to you. And just a reminder that you can only submit one comment per person or per organization. So do take the time to really thoughtfully prepare for this. Proofread it, make sure you've got everything in there that you want to say, because you will only have one chance to submit a comment. Next slide, please. So we anticipate that our form will be ready next week. By using our form, it will simplify the process of submitting your comment. It will be very similar in setup to the advocacy forms that we had for contacting Congress. However, rather than going to your members of Congress, it will go to CMS. Once again, there will not be any template. You will just have to fill in your name and your address, all of your contact information. And then there will be a box where you will submit your comments. So I would highly recommend that you pre-write your comment, you know, elsewhere, and copy and paste your personally written comment into the form when you decide to do it, as that is probably more practical than typing it into the box that's right there. That way you can use your spell check and everything like that. But that will be the format of the form, and we do anticipate that it will be set up and available by next week. And the public comment period ends on August 29th. But just in case there are any delays from the moment you hit send through our form before it actually makes it through cyberspace to CMS, we are going to ask that anyone who uses our form do so by the 28th, just to make sure that it is received by the deadline of the 29th. So if you're seeing two different dates, that's the reason why we're asking for submissions by the 28th, even though the actual deadline is the 29th. Next slide, please. All right, and here are some additional resources for you. These links are also in the Q&A, and when we share the recorded version of this video, there'll also be the links available with that information. But as Sarah showed you in the beginning, there is a link where you can read the actual entire section dealing with lymphedema compression coverage in the rule, even the section that is just about this is, I believe, about 30 pages. So it is a lengthy read, but it's really important that you read it for yourself before submitting your comments. We do have a one-page summary of it. That is the second link. We have a great document full of even more tips than we've gone over in the webinar for submitting effective comments. And those are actually tips from CMS about, what makes a comment more or less valuable. So really good information there for you to review. And then if you missed our webinar last week, a recording of that is available at the final link. And of course, we'll also have a link to this webinar as well, probably available sometime next week. Next slide, please.
I think that's going to be our last one. So I just wanted to add, as part of the tips for submitting effective comments, as it's mentioned, this is going to be a part of a larger home health rule. So there will be comments coming in about other parts of that rule. And so part of the effective tips is to make sure that you mention that you're commenting on the Lymphedema Treatment Act implementation. And then specifically, I'm commenting on the quantities allowed, or I'm commenting on the codes. And with that, we did mention that anyone who is a vendor or a therapist who might be interested in the Compression Alliance information sessions, you can please email us. I'll go ahead to the next slide. That is our email address there, and that will also be posted with the Q&A. Email us if you'd like us to get you that information. And another aspect of this, and we didn't want to include it in this because it doesn't necessarily affect all patients, but in reading the other areas of the home health rule, because I'm a Medicare patient and this is a Medicare rule, I was interested. So there is a aspect of the rule where they're soliciting feedback regarding home health aides. Now this is separate from home health therapy or nurses. So this is actually like a home health aide who would come in and assist you with activities of daily living. If you are someone, we've had a few patients just over the years and even more recently mention having someone that is an aide, home health aide, that helps them with their compression pumps or with their compression garments. And we've actually heard the need for better services such as that. So if you are interested in getting that information from the rule, I have pulled it. I didn't want to include, I didn't want to blur everything tonight, but if you are a patient or a caregiver, and that is something you're interested in reading more about so that you can include it in your comment, please email us at the email on the screen, the third bullet, and we'll get you that information also. And so again, this is how you can contact us. We will provide any assistance you need in composing your public comment. You can sign up for our newsletter so that you get that action alert whenever we have our form ready. We have our info@lymphedematreatmentact.org email address. And again, the link to the frequently asked questions that we put together regarding the bill and the new law. So at this time, we're going to go ahead and answer some questions. And if you can please just go ahead and put those in the Q&A area and we'll answer those. Some of them might just be answered directly and some will answer live. So if there's any that you guys already know that should answer live, let me know.
Francie, if you want to go ahead and flag some for Sarah. I am for some reason unable to see what's been entered in the Q&A, so I'm going to leave and re-enter and hope that solves my technical difficulties, but please proceed with the Q&A.
Yes. A quick and easy one that you probably know, Sarah, that I don't is Larry Beck asked for once a year. Does that mean every 365 days, or is it calendar year, or do we know that?
So it's going to likely be coverage year. So the Medicare coverage begins January 1st through December 31st. So when Medicare says something per year, it's going to be per coverage year. And we also need something to remember with anyone who's probably experienced this, and I'm sure it'll be the same. As it comes towards the end of that coverage year, typically the date of service for compression is the delivery date. So we want to make sure as we get towards the end of the year, and I know many of the vendors do send out reminders that if you need to place an order, you do so that you make sure you get that item before that December 31st cutoff.
Okay. Thank you. Sarah, you had mentioned that people's comments will be posted on the Medicare website. And Victoria wants to know if that will include their personal information, like their name.
Yes, so the comment would have your name. It doesn't have any other information. If someone is interested in an anonymous way, they can email us.
Okay, thank you. Let's see. Julie Fulton is asking, you mentioned this is under home health. Would these new codes be billed under Medicare Part A? Can they be billed by outpatient clinics under Part B?
So, so the new benefit category is a Part B category. It's just every year there's, I believe, a mandate that the home health there's an overview of home health guidelines, and so the rule was already coming out, and so that's why they included our coverage information under the overall umbrella of the home health rule. But no, it does not necessarily mean any of this is tied into home health. It's specifically under the law that passed in December, written that it is a Part B benefit category, and so it would be billed under Part B. Now there is some, they're not sure how this works when a patient is receiving care, like in a skilled nursing facility, or is receiving home health, how all the elements will work with that. So if you are someone who works in a skilled nursing facility, or you're receiving home health, physical occupational therapy, and you're getting lymphedema services, but the benefit itself for coverage of the compression garments and items is a Part B Medicare benefit. So with that, because it does mention this in the rule also, and in regards to reimbursement. So just like every other aspect of the Part B Medicare coverage, patients will have a 20% patient responsibility. So, the reimbursement rates and everything will be, what is allowable, whatever thing, and what the allowable billing will be, and the patients will still have a 20%. If you have a secondary or a supplemental, that usually picks up your extra 20%. Likely they'll pick that up. As far as how this works with Advantage plans, Advantage plans have to provide the same coverage as standard Medicare, so they would have to provide coverage for these garments in the same, outline. But as far as some of the other details as rates or quantities or frequencies, I don't know if they will have to follow those same exact details.
All right, thank you. Cecilia is asking that we talk about measurements being taken by physical therapists. And she found out that there's a store connected with the hospital. And what are the guidelines about getting measured? Do I have to pay that person in addition to the price of the sleeves? I know that here in my area of Ohio, the hospitals do have you go through the store currently, and this is not anything to do with Medicare, but just in general. And the hospital store charges an additional percentage. So I don't know if that's the case or how that will work with Medicare. Do you, Sarah?
I do not. I would say this shouldn't. There shouldn't be any. There shouldn't be any additional fee. Like what they're trying to figure out is where typically the payment would be added to the cost of the garment. But since the person supplying the garment themselves, the vendor, isn't necessarily doing that measurement, depending on the situation, but typically they might not be doing that measurements, then they're looking at, should they not have the fitting fee? But the fitting, I would think, would still be covered and not necessarily an outside thing. But again, if that's something that's your concern or question, you can put that within your public comment. There is no answer to that. This whole question about fitting and who's getting reimbursed for fitting is something that CMS is soliciting feedback on because they haven't proposed an actual answer to. Heather, do you want to add anything more to that?
So I only heard a part of it. So I might be repeating something you already said. So let's just leave it at that. And
Okay.
Okay. Angeline asked about the link for comments to CMS, and I believe that she's talking about our link that we'll have on our website. That's not available yet, but it will be coming soon.
Yes.
And she's also asking, will they pay for multiple garments, lower extremities and upper extremities at the same time? And well, go ahead, Sarah.
So yeah, so we will be providing a streamlined process for submitting the comments. It's best if you do have it proposed in advance, but we will plan on having that out next week. And just watch the newsletter. If you're not signed up for it, sign up for it. And that will be available next week, so you can submit your comment through there. As far as upper and lower extremities, yes, the current proposed coverage is 2 daytime garments per affected body area. So if you have both lower extremity and upper extremity lymphedema, you'd get 2 garments for each of those affected body areas every 6 months, and 1 nighttime garment per affected body area once a year. And that was one of the questions also, if they are soliciting feedback, if that should be changed to 2 nighttime garments every 2 years.
All right. Jillian is asking about a specific item and which code that would be included in. The compression shorts come under gradient compression garment genital region custom. So
Heather, do you have any insight? I mean, I know right now they have, of course, like waist high, thighs, and different such. So I don't know if they're, what your thoughts on needing that specific, or do you think it's covered under some of the ones they have currently?
yeah, I would say that's unclear at this time. So if you wear a specific item on a specific body part and you are not confident that you see it reflected in one of the codes that has already been proposed, better to be on the safe side and mention it and say, I need this and I want to make sure that there is a code for it, and it is unclear if there is. And something to that effect, better safe than sorry to mention it in your comment.
I was going to say an example of that is toe caps. We've heard people say, we see gloves mentioned, we don't see toe caps mentioned. And in conversations, I said, toe caps aren't mentioned. Someone said, oh, but it mentions foot, and I thought, well, but it's still different because, I mean, I wear foot, but I wear open toes. And I know there's some patients who wear open toes and still need toe caps versus trying to get a garment that has the toes as part of that. So I think it would be very important, again, as Heather mentioned, if there's an item that when you look at that list of codes in the bill and the proposed rules language, and you don't see something that you use or something that to cover, specifically a body part, then mention it so that it's on their radar to consider making sure there's a code for that specific item.
Yes, and this is something that the manufacturers to the U.S. Medical Compression Alliance are going to be keenly focused on, because they are very aware of all of the different products out there and want to make sure that there is an appropriate code for all of them. But it could only help for them to hear from patients as well, to make sure that there are that nothing is left off unintentionally.
Okay. Beth asked, when they are adding their name to their comment, Are they allowed, if it's multiple members of a family working together in a comment, can they say the Meyer family? Or do they need to say specifically Larry, Beth, Hannah, and Sarah Meyer, for instance? Or-
That's a good
Oh,
question. I don't know that we know for certain the answer to that. We could ask someone with more knowledge about that, about the best way for you to handle it, like how you should sign that if you prefer to do one submission on behalf of your entire family rather than from each individual separately, since obviously you probably feel as though it would be repetitive if you all did it separately. So let us get back to you over email with a more specific answer to that question. And thank you, Francie, for continuing to read the questions. I am still not able to see them until they are already answered. So thank you for raising the unanswered questions for us.
Okay, yeah.
I can see some of them. So if you want me to.
Yeah, if there's anything that pops up for you, Sarah, that you think is most important to be answered.
Yeah, so let me go up because I see some that haven't. Let me, so
Perhaps the
Finn
one
has
from
asked.
Olga.
Yeah, Finn asked about, yeah, the garments. There's both well, off the shelf, they're also called standard fit and then
Yeah.
custom garments. And he brings up the point that with the custom, there's variant degree, gradient pressures. And actually he brings up that they go up to 70 and 80. And that has been mentioned that the current list, I think, stopped at 50 and that there are a need to make sure there's coding and availability for the entire spectrum of compression, and that there are patients who use compression higher than what was listed in the proposed rule. So if you are a patient who uses higher, certainly bring that up. Another question Fenton mentioned was with the custom measurements and being so critical about having them measured both by a therapist and a certified fitter to make sure they are correct. I am not sure how feasible that would be in the current situation. And I will say one reason why it's not as feasible is patients often don't have the access to both. I mean, if they did and it was possible, certainly that would be good. We know even when a therapist takes the measurements, the vendor, whoever's placing the order, will want to make sure they double check. I know as a patient who's wore custom over the years, and that the company themselves, the manufacturer, has my measurements on file. If there's a huge change, they will ask, like they will flag it and verify those measurements before they make my garments. But having both do it, as ideal as that might be, I don't see it feasible. Not only for right now, they're trying to figure out who's gonna, where the measuring is taking place, and we just know overall the availability of either for some patients isn't, especially in like rural area and things, that just might not be feasible, but certainly something to keep in mind. And we are well aware that many European clinics are ahead of us, and as it goes with treating lymphedema in general. So Olga is asking about if the therapist measuring that the therapist must be enrolled as no, so not to take the measurements, so right now they're looking at if there's a way to cover it under a HCPCS code, the measuring. If they want to actually supply the garments, they would need to be a DME provider, but not to. So just to remember, therapists measure patients as part of the treatment process. So, they're measuring patients, throughout, the initial evaluation, and then they measure them throughout to see what progress is being made. And then, once those measurements usually level off is when they decide it's time to a garment. And of course, the measurements for the garments are more intricate often, but to take measurements, that is not what is being proposed, that they would have to be a DME provider, only if they were going to physically be selling and billing Medicare for the garments.
Yeah.
Okay, I'm just reading one. Regina is asking for the warranty on compression machines. It sounds like it's a
Yeah.
pump question.
It is.
I have no idea. This is the bills about compression. So anything about pump
Yes.
coverage, I would advise you to ask the pump companies and the pump representatives what they can do in regards to the CMS coverage and changing those criteria or improving the coverage criteria for pumps. Okay, and I'm going to go ahead and I think I answered that all. So any more
I'm not
questions?
seeing any other open questions.
Yeah, I don't see any either at this time.
Yeah.
And we're about 10 minutes till.
We just got another
So Heather,
question.
do you have any? Oh, sorry. Now we prompted some
We
questions.
do have
Okay, not a problem. That's why we're here.
Yeah.
Larry would like, do the rules specify warranties on the garments? The rules do not specify warranties on the garments. Warranties and any type of requirements or not to say requirements, but the warranties or fitting criterias and everything would be manufacturer's warranties. And those of course vary on the garment type, daytime or nighttime or the compression wraps. So as far as I know that, especially for custom, manufacturers have a certain time that you need to notify them of a fitting issue, or like, especially for nighttime garments, some of them do have a set time for issues or remakes. So those are by the manufacturers, and that's certainly not something CMS would usually get that detailed information. Now, as far as criteria for as we discussed, the more frequent replacement, if people needed them, that would be something that those details, we mentioned this last week, those details will most likely come from a local determination or a national coverage determination. So for example, we're talking about custom garments or people needing a replacement sooner. The rationale or the information that needs to be provided for those is going to be like another stage of the implementation process. So for example, a patient who needs custom might have to show the containment requirements or the initial measurements to show that they're outside of a standard fit garment. Again, we don't know. We have asked CMS to please make sure that they are not burdensome and that patients who need custom can get them as quickly as possible, as it's very important.
I am able to see the questions now miraculously. So someone just asked if there has been discussion about the competitive bidding aspect. So at this time, CMS does not have any immediate plans to put these supplies through the competitive bidding process, which is why they have proposed what they have for pricing the garments next year using existing Medicare, TRICARE, and in some instances, average retail online pricing. Now, we can't say that they may not want to put them through competitive bidding in the future. That is a possibility, but there is no immediate plan to do so. There's another question here about the gloves to help you put the garments on. That would fall under a donning aid, and that was mentioned in the draft rule, so those should be covered. Another comment here from Julie was it suggested to have a separate fitting code. Yes, it has been suggested. There will definitely be organizations and individuals advocating for that approach of unbundling the reimbursement for the garments so that it's not one lump sum with the fitting and measuring services included, but whether there is a separate code and separate payment to whoever does the fitting and measuring, whether that be the therapist or a certified fitter through a DME supplier, and then payment for the actual item itself. This would better facilitate patients having the flexibility and option to be measured by either a fitter or a therapist. And as Sarah already mentioned, some patients don't have the luxury of choice. Some patients only have access to one or the other. We feel strongly that both options should remain, so that patients have all possible opportunities to be measured by the best, most qualified person suited to measure and fit them for their garments. So yes, that has been proposed. I'm sure many individuals will be including that in their comments, and we don't know how CMS will ultimately decide to handle it, but that is one possible solution to this kind of tricky situation.
And I don't, Heather, you might not be able to see it. So Fenton has another comment regarding maybe a comprehensive standard for measurements on all garments for the certified therapist. So that is, you know, a possibility. There isn't, you know, as far as like when it comes to prosthetics and mastectomy items, is a certification for fitters. As we know now, for when it comes to custom garments, each manufacturer does provide that individual training for therapists or fitters, whoever wants to supply those garments. You know, the manufacturers themselves have regional representatives who go out into the field and help teach people how to fit their specific garments. So something as, you know, a universal fitting is something that can be an option. It's just not something that exists currently.
Right. Yeah. And just my take on that. I understand where you're coming from on that, Fenton, because like, as I said, in our neck of the woods, it's being done by gift shop clerks. And, you know, how is that comparable to having an actual certified lymphedema therapist do your measurements? And since I lead a support group, a lymphedema support group, I see that it does not work out a lot.
And we are coming up about 5 more minutes. So just a final call. If anyone has questions, you can put them in the Q&A. If you have any additional questions you'd like to ask us directly, again, our email address is on the screen. And we will be working to get that form ready. And again, sign up for our newsletters if you haven't already signed up.
And just want to remind everyone that we're here, you know, to help you with composing your comments. You know, it can be very challenging, just like it was sharing your lymphedema story, to kind of sort out what's the most important points to include and the most effective way to saying things. And so we're here to help anyone who would like assistance with their comments. I know one of the things that I've heard from a lot of patients is the desire to get more than 2 sets of garments every 6 months. And sometimes that is based on, you know, medical necessity. They notice their garments wear out before 6 months and they're concerned about their ability to get more. But some patients I've heard saying, well, I would just rather not have to do my laundry every day or every other day. And I would caution you to not include reasons like that, because coverage is not based on convenience. You know, so really focus your reasoning around medical necessity, whether it's the quantity of garment or the exact type of garment you're concerned about getting. It all centers around medical necessity, because that is, you know, the reason that we, you know, needed coverage for these items to start with. So make sure to keep your comments focused from that perspective.
I have also had patients mention that their current insurance supplies more than 2 every 6 months. So depending on what that insurance is, I know someone mentioned the VA, and I think we all know sometimes the VA does provide a lot better coverage for our veterans, which of course is well deserved. But if, you know, that is something as comparable, you can mention that, you know, you hope that as you age on to Medicare, you'd have that same benefit, or mention how, you know, as Heather mentioned, how having those help you medically. But you know, again, try to back up. And I think we mentioned, you know, either personal experience or citations. Now, CMS certainly understands patients don't have access to all the medical documentation that might have, but just your personal experience. As your personal experience was key in helping get this bill passed into law. Hearing from patients will be, very important for CMS. They've heard from many organizations, and of course, many organizations that treat patients, or like our organizations that have, most recommend or represent the patient view. But hearing specifically from patients will be very important in this process.
And it looks like we have one final question here from Victoria, and she's asking if the comments should reference a specific page or number or paragraph. And yes, that's actually one of the tips in one of the links that we've shared, is that the more specific you can be about what part of the draft you are commenting on, it really helps them, to understand your comment and give it thoughtful consideration. So yes, whenever possible, do include those kind of specifics.
Okay, and I think with that, we will thank everyone for participating. Again, this session was recorded, and like last week's webinar, we'll be able to provide a video recording of the webinar along with a PDF of the slides that we used and a PDF of the questions and the answers that were provided. So again, I want to thank everyone who joined us this evening, and especially I want to thank Heather, Francie, and Cindy for their help in managing the webinar. Thank you, everyone, and good night.
Thank you. Good night.
Thank you.